Hello, Internet! This is going to be what I'm hoping is not going to be too depressing of a blog, because I haven't really talked much about this. I'm going to try not to be really depressing, considering it's going to be New Year soon. I have absolutely no makeup on, so I apologize in advance. But it's late, and, you know, I'm not going to put makeup on to talk about something. So, exactly what this video is entitled. I'm going to be discussing some personal information, strictly for, you know, other people in my situation. So, this is going to start from the beginning, and I'm going to try to end on a high note. So, Tuesday, November 12th, 2017, I got a phone call from my mother saying that my daughter had spiked a fever randomly, you know, out of the blue. And because she's, you know, with three, almost 4, I'm like not thinking too much of it. And I had just come from surgery, I changed jobs, and I was like, oh, okay, it's fine, just take her to the doctor. And then I proceeded to get another phone call saying that my daughter was going to go for ultrasound imaging. And that's when I was like, I wonder if this could be an appendicitis or something. And, you know, I had to call with the insurance, and then that's when I kind of started to get worried, at this point. And so my phone's dying, you know, at this point, and I'm driving home from work frantically. You know, the doctor calls me and says, you know, do you have a minute to talk? And it's, you know, hooked up through my Bluetooth through my car. So I'm like, yeah, sure, it's fine. And then she puts me on hold, and then, you know, says, oh, you know, doctor's gonna have to call you back. At this point, I'm panicking, because I'm like, I don't know what's going on. I'm assuming that I was going to get results from this ultrasound, and I didn't know what to expect, especially because you don't normally get results that rapidly. So I, you know, I'm coming home. I'm, you know, maybe 10 minutes away from my house. Again, my phone is on like 5% battery, and her pediatrician calls me and says, you know, your daughter came in with a fever today, and she's going through all this medical history with me. And I'm like, just tell me what you found. Like, just tell me what's going on. And she said, unfortunately, I have to inform you that your daughter has a large tumor on her kidney. And I almost panicked. I almost swerved off the road, in all honesty. I wish I wouldn't have been driving when I found out. So, time marches on. I'm now panicking. She tells me, you know, your daughter's going to be admitted to Diamond Children's Hospital at Banner University of Arizona Medical Center, and she's telling me all this information, and I'm not able to process it at all. And so I get home, and I plug my phone in, and I'm like, please tell me again where, you know, what we're doing, where we're going. Like, I need to write all this down because I'm not going to remember any of it. So they tell me, you know, we're going to be admitted and all this, and I'm like, okay. And I had to tell my parents the unfortunate news. My daughter had been 100% healthy, happy, developing normal up until this point. And so we drove her right away to the hospital. We were all devastated. We didn't know what to expect. Again, the word cancer didn't come out of anybody's mouths right away. And so we get there, and my daughter's immediately like, what's up? You know, she's very intelligent in that aspect. You know, she's not stupid. I can't hide anything from her. And she just kept asking, you know, why are we staying here? Can we go home? And I'm like, baby, we can't. We have to stay because you're sick. And she's like, but I feel fine. I'm like, I know you feel fine, but, you know, you've got, you know, a big bump inside that we have to get it looked at. So, you know, my hospital experience was horrible. They started an IV at like 2 in the morning, and it was bad. We met with an oncologist, and that's when I was like, that's a cancer doctor. I mean, I've worked in medicine long enough that oncologist means a cancer doctor. And, you know, I've got residents and attendings and students and student nurses and everyone bothering us, you know, constant. The next day, the first night in the hospital, you know, all that IV crap, that was fun. The next day, a pediatric surgeon comes and feels my daughter's stomach and says she probably has something called a Wilms tumor. It needs to be removed. I'll see you in surgery tomorrow after we get imaging. And I'm like, okay. She kind of whisked in and whisked out, and I was very confused. And then, had to tell my parents while they're talking about taking her kidney out. And, again, cancer wasn't something that anybody flat out told us what she had. So, shortly thereafter, we had a sedated MRI and CT scan. And we were waiting on the results of that. And it was confirmed that she had multiple large masses, cancerous masses, all over her insides, her lungs being the worst, which my daughter's never had respiratory problems, asthma, nothing. She's never had anything like that. We have only had really one chest x-ray that she's been, since she's been born, where she got kind of sick, and again, none of that was viewed before. And the only thing that was consistent through all of this is that my daughter's blood pressure had always been high. Every time we took her to the doctor, it's been high, high, high. For somebody who's 103 centimeters, they shouldn't have a blood pressure of like 132 over 80. It's a little, that was the only thing that really seemed abnormal, but we just figured she got nervous or, white coat syndrome, what have you. And, after those scans, the next day, it was discussed that they were going to do a biopsy on one of the tumors on her lungs. And, every time that someone came in the room, it was worse news. It wasn't getting any easier. And so, finally, the term cancer started coming out of these people's mouths, and I said, so wait, my kid has cancer. My daughter has a stage 4 Wilms tumor that has metastasized to most of her body, and now what do we have to do? Everything was up in the air until we got the biopsy results back. Cancer cells can have 2 different types of what they call histology. Histology is literally the study of the tissue. You can have favorable cells or anaplastic or not favorable cells, and what we were hoping to see was the favorable histology, obviously, and because if had it been anaplastic or not favorable, our outcome would have been way worse. So it came back that she had favorable histology, so that was good. And so the good news is there's a lot of research and stuff out there about Wilms tumors in children, and literally all the textbooks and bits of information I've gotten literally show that, it's very responsive to chemotherapy, and surgery normally will work. It's got like an 85 to 95% survival rate, and, we were in it for some rough times. And so what was scheduled originally, the plan was 6 rounds of chemotherapy, and then a repeat scans, and then surgery of some kind. So here's where we're at. Tuesday, January 2nd, will be my daughter's last chemotherapy treatment session before she gets some kind of surgery on her body. And we're holding it together the best that we can. We've gotten in a routine with the chemotherapy, and she's gotten vincristine mainly. She got doxorubicin, which we had to have an echocardiogram to make sure. And so we've been in it for the long haul, and it's something that none of us thought was ever going to happen. And the fact that it did was, pretty devastating. Because my daughter is super strong and super smart and just adorable, and she's awesome, and she's been awesome through all of this, and we're still getting used to having the port accessed, which is difficult every time. She's got a power port right here, and we put some numbing cream on it, and then they stick it with a bored out needle and draw labs and deliver the chemotherapy drugs through the port. So this is, we've basically completed the first leg of this journey. And January 15th, she'll have repeat scans to determine how responsive everything has been to the chemo. And then after that, we're anticipating some kind of surgery. And the most common surgery that you do to treat a Wilms tumor or Wilms cancer is to take the affected kidney out. So she'll have one kidney. And, you know, everything happens so fast, and you don't realize how fragile and flimsy and quick, you know, life really is. Luckily for us, she's been doing relatively good with the chemotherapy, not a lot of vomiting. She's lost some hair, but it's nothing that she, you know, we can't cover up with a ponytail. You know, it's not like all of her hair fall out, but it has come out, and that was pretty rough to go through for a little bit. And it's hard because, you know, like I said, you don't anticipate these things happening, and then all of a sudden they do. I've had so many well wishes, thoughts, prayers, prayer groups. I mean, every single religion I can think of has contacted me and put my daughter on a prayer list, and that's incredible. The response from very charitable organizations has been fantastic. I mean, of course, all this happened before her 4th birthday, before Thanksgiving, before before Christmas, and you know, everyone has done above and beyond anything that I had ever expected. I've had to take off work a lot to take care of her, and my parents, you know, have been taking care of her, and trying to be a mother to a child who has cancer, especially a single mother, because I'm not married, I don't have, you know, any other children, you know, can prove a little difficult at times, and that's why I've kind of shied away from a lot of the other YouTube things that I've been doing in the past. But I look back on all those videos I've posted on my channel of her as a baby, and you would never think in a million years that she would get cancer. So all in all, we're hoping for you know, a favorable outcome and to get this last part of this done. After surgery will then be radiation to that tumor bed to make sure that it has eradicated all the cancer cells, to make sure, basically salting the earth in that area to make sure that it doesn't ever come back. So that's what's been going on. Selena has been doing really good. She's, you know, she's been really strong throughout this, a lot stronger than I would have been if I had cancer. So, I mean, you just look back and at what a strong little girl she is and just realize how lucky I really am. So, again, I appreciate thoughts, prayers, cards. I mean, everyone out there in the universe who knows me knows how truly humble I am to have all of you in our lives. I mean, it's made such a difference for us, and I'm so thankful. I'm really, truly thankful. So, again, thank you. I appreciate it, and let's just keep hoping for favorable outcome and for my daughter to see the rest of her birthdays and pretend like this is just all a bad memory. So, again, I appreciate it. I don't have any blog posts or anything like that, but I really do. I appreciate it. Everyone reaching out and supporting us. So, thank you, and good night.